Hi, this is Dr. David Tener. We're here at the Goldberg Tener Clinic. We are joined by Miss Shellae Etheridge, and she's here today, 3 months after coming in for her initial appointment. Shellae, what brought you in a few months ago? What type of problems were you concerned about?
My weight, my energy level. I had really bad headaches very often, probably every other day at least. All of my normal diet, exercise routines, even the diet clinic medicine that I would take, none of that was working anymore. And I think it was just it was a low point for me, honestly. So
Yeah, I remember when Shellae came in. She's not a depressed person, but I think she was feeling somewhat depressed just about
about myself. Yes.
Yeah, just about your health situation. And you had been to a weight loss clinic, is that right? And they had prescribed you a drug called Tenuate. And what was your experience with that?
It worked at first. It was just an energy boost. It was just a speed, or of the light. But
Yeah.
And after it's worked, it doesn't. So.
And that's typical for a lot of patients that go down that path. And as Shellae knows, there's no shortcuts in that respect. And the best way to lose weight, normalize weight, is to improve the person's health and to do everything possible in that respect. And when we do that with patients, not only do they end up losing weight, but they get healthy all over at the same time. And that's the main thing that we told Shellae when she came in that we needed to focus on. So she had problems with her weight, was trying to lose weight, but had trouble doing that. Had a lot of fatigue along with it. Frequent headaches. You also, as I recall, had pretty bad seasonal allergies, particularly in the fall.
Yes.
Is that right?
Yes.
And you were in the past would take Zyrtec pretty regularly at that time. Is that right?
Yes.
Okay. And there's also, as part of this, just not feeling well with fatigue and all that. She also struggled with some poor libido. Is that correct as well? Yeah. So the important thing to recognize is that all these things were very likely to be interrelated, all part of the same problem. We knew if we got Shellae on the right path that we'd see a lot of these things improve simultaneously. And Shellae's had a remarkable turnaround, actually much sooner than I would have expected. I think it was a good sign that not only are we pretty good at what we do, but Shellae made very good use of the recommendations and worked really hard and was very strict and very disciplined with what we had her do. So Shellae, I'm just going to let you talk about all the nice improvements that you've had. So tell us what's changed after just 3 months.
Well, I've lost over 35 pounds. My energy level is fantastic. I haven't had a headache. I think since I went off the caffeine and stuff, I haven't had a headache, maybe one since then, seasonal stuff.
And these are things you would have multiple times a week.
Oh, yes.
Yeah.
Bad headaches too. Not migraine, but bad headaches. My energy level, I feel better about myself, of course. Any of the digestive issues that I had, I don't have those anymore. Everything's working fabulous. I love it.
And you're off the weight loss medication.
Yes,
right?
I haven't.
Drug-free.
Yeah, I haven't taken any. Completely drug-free.
And the Zyrtec that you would need to take in the past for pollen season, you haven't had any take this fall. And right now we're in October, so we just went through the fall season in Georgia, which is pretty heavy. We get a lot of pollen down here.
Yes, and I haven't had the itchy eyes, the runny nose, the sneezing fits. I haven't had any of that. I think I've had one headache through the seasonal stuff, but that was all I had, which.
Wonderful.
And drug-free, so.
Yeah, and as a result of now feeling better, looking better, getting the weight off, energy is up. Has your libido started to return too?
Yes, yes.
Wonderful. Yeah, so we're just thrilled for Shellae. She worked hard. She made changes. We gave her a bunch of steps and stages that we had to work through, and her body has responded wonderfully in just a 90-day period. And it's just a great example of the success that can happen when we do a thorough evaluation and get the right information we need to identify where the problems are coming from, give the right advice, and then have a patient like Shellae who makes such good use of it and puts the effort in. She's certainly earned all the good achievements that she has achieved and reported today. So Shellae, just want to thank you for sharing your story. We're delighted with the progress and look forward to your ongoing success in the future.
Thank you.
You're welcome.